The COMLEX loves to test on scoliosis. Why? Because it is really complicated and intricate. It has a lot of structural, osteopathic, skeletal muscle caveats to it. So let's dig in. One of the many questions you might get would be, what is a Cobb angle? How is it measured? This is really important in the face of scoliosis. And I want you to remember a corn on the cob, exactly as it is, literally. I'm a Midwesterner. We love corn on the cob. This is our jam. But I want you to envision this whenever you have to calculate the Cobb angle. Why? Because they're going to ask you, how is this Cobb angle measured? I want you to think of this corn on the cob and just think of these corn forks kind of like going on the top of the corn and on the bottom of the corn, okay? This is what we're looking at here on this scoliosis diagram, okay? Then they draw a 50-degree or 90-degree perpendicular line, and the angle that's created between these lines is called the Cobb angle. And that's how they measure it. Kind of complicated, but all you have to remember is just the angles and what it means for the patient, okay? There are 3 phases of severity, and this can impact the clinical course for this patient and what the next steps are. So I want you to remember just 2 numbers, 20 and 50, all right? Don't stress about remembering exactly 21 to 45. Just remember mild is up to 20 and severe is 50, and then everything else is in the middle. Mild scoliosis can be idiopathic, it can be structural, it can be functional, anatomic, whatever, but the treatment for it is pretty much the same. What we do is OMT, home exercise, and observe. It can go away, it can get better, it might need more workup, but it's pretty much watched until it gets worse. Moderate scoliosis involves bracing. This is when bracing is more recommended, and it's fitted to the patient, and they do serial x-rays every 6 to 12 months just to monitor for progression. Now, severe scoliosis is severe because it can actually start impacting the organs in the body. And as you can see in this x-ray, the scoliosis is quite severe. If you take a Cobb angle here, take a Cobb angle here, you do this, then this, that angle is pretty significant. So what do we do for that? Surgical fusion, primarily because look at how it is affecting the heart, and it's starting to crowd the heart, it's starting to crowd the lungs, it's going to start crunching everything up and making it really difficult for this person to breathe and to pump blood. And so therefore you would want to do a pulmonary function test for their baseline for this reason. So surgical fusion of these lumbar or these thoracic spine are critical. So now there are risk factors for progression. This might come up on your level 3 exam, but things to remember: what would cause scoliosis to get worse? Well, females who are premenarchal are usually at risk. Anyone who's less than 12 years old are at risk of further progression just because they can continue to grow, their bones are still developing, and it can further worsen the curve. If their Cobb angle is greater than 20 degrees, that is more than mild scoliosis, that is pretty significant. And having double curves and a higher riser score, which just means ossification. So remember, SS, riser, ossification. If it's ossified, it means the bones are more in shape and they're less flexible and less able to be manipulated back into a normal curve. So let's put this into practice. Feel free to pause the video and think about it, and then we can go through the questions. So a 10-year-old boy presents for an annual physical exam. He's healthy with no recent illnesses. When he bends forward, you notice a right rib hump. The Cobb angle is 15. What do you recommend? Well, if you remember, mild is 20, and then severe is 50, and then moderate is in between, okay? What do we do for mild? Well, mild is watch and follow up. All right, good job, guys. Question number 2. 20-year-old female presents for shortness of breath. she has degenerative spine condition. She has received bracing for most of her young life, but the curve has progressed to 60 degrees. What is the next step? Well, mild is, again, 20. Severe is 50. This is definitely already severe. The next step for that would be surgery and pulmonary function tests. So the answer is D. As osteopathic physicians, we must also think about how scoliosis will affect the rest of the body, especially in the skeletal and the muscular aspects. So when we think about scoliosis affecting the spine primarily, we also must remember what happens in the pelvis and the legs. How might this present? Well, what happens is when the spine curves, it's going to cause the short leg syndrome. What is a short leg syndrome? Well, as simply stated, it is a short leg. So with the spine curvature, it's going to cause this side of the body to elevate just a little bit, and so they are going to clinically get a short leg. And so there is a gap between the anatomic actual length of their leg and then this artificially or structurally shortened leg. They can also get an anterior innominate rotation on the side of the short leg. And then they will also get tight iliolumbar ligaments, so tension that needs to probably be treated with some OMT. You might also be asked, how is a short leg actually measured? Well, you can just do straight up and down, which is their apparent leg length, or you can measure from the hip to the medial malleolus of that leg, and that is how you get a more accurate leg length for this short leg. So you compare the two leg lengths through this way, and you can compare and contrast and see what is actually short. So the ASIS to the medial malleolus is the true measurement. So short leg syndrome can be treated in a few ways. This may or may not come up on the exam, but I know I did get a few practice questions related to this when I was previously studying for COMLEX. So as we discussed some causes of short leg syndrome, it can be genetic, hip replacement related, or trauma related. And there is something called the heel lift treatment. If they're older and say they had a hip replacement, the increment at which they would have their short leg syndrome addressed, which would be primarily fitting them to shoes to make them feel more comfortable and live with this short leg long term. They have a progression of a 1/16 adjustment each visit. Okay, so elderly take it low and slow. They're not going to be walking around with high heels. Young people can probably handle it a little bit more adjustment, so they're bumped up more, more increments, about 1/8 of an inch, and they can adapt to that pretty well. And the goal is about a half-inch maximum heel lift every 2 weeks. And of course, the heel lift goal ultimately would be around this range. So it might not be tested, but if you just need to know it, this is all you have to know. Do not stress too much about this. And there you go. That is all you need to know about scoliosis and short leg syndrome.